Okay. Hi, my name is Megan Abbott, and I'm going to do an interview assessment and the head and neck assessment on Sue Gifford. I just wanted to show, I do have the authorization form signed, so that's all been done, and we're going to get started. Thank you. All right. Hello. Hi, my name is Megan Abbott. I'll be the practitioner today.
Okay.
And I just want to go down a little bit of a rundown of your just pertinent information. First off,
Okay.
you are 66-year-old.
Yes.
Your blood pressure when you came in was 121/72, so that was great.
Good.
Heart rate was 72. Your temperature was 98.2, so that's perfect. And I really just want to go over what brought you in today.
Okay. Well, I'm coming today because I had a cold a couple weeks ago, and I've just noticed over the past few days, in the morning especially when I wake up, I have just kind of a raspy throat. It does get better, but I just wanted to make sure there was nothing brewing.
Okay, all right. And so with your sore throat, it's been going on for the past couple days?
Yeah.
Is that correct? All right. And with that, have you been having any trouble breathing or trouble swallowing?
No.
All right.
None at all.
Okay. And have you noticed any severe pain with it, or is it just
No.
kind of more or less?
Just a little aggravating.
Okay. All right. And in the past few weeks, you said that you've been having some sinus congestion
Yes.
and things
Yes.
like that. With that, have you been running any fevers?
No, I have not.
All right. And what color has the drainage been?
It's just been clear.
Clear
Nothing.
drainage? There's never been any yellow
No.
or anything like that?
Nope.
All right.
And I just took some Advil cold and sinus when it was really, symptomatic, and then it's kind of, I've been off of it now for a week or so, and like I say, it's kind of gone away. But I just noticed just a little bit of dripping every now and then.
Okay. All right. And with the dripping or with the raw throat, have you been having that issue more at night, or does it get better during the day?
It gets better during the day.
It does. It's just,
I
it's
notice
worse
it
upon
most.
waking up.
Correct.
All right. Have you been having any headaches or earaches or anything along with that?
Nothing like that.
All right. Or any neck stiffness? Nothing
No.
like that. All right. And have you been having any other concerns, medical concerns?
Nothing really. I don't know if we need to go over my whole history,
Yeah.
so that I could fill you in on that. But so far as any other concerns, no. I feel
No.
perfectly good now, and I had a rough couple years ago, but other than that, we're good.
All right. Wonderful. So I'm just going to go over your medical history.
Okay.
First off, should I get a pen out?
Probably.
All right.
Yes.
Okay. So I just want to first go over your medical history. What sort of medical problems have you had?
Okay. Well, just in a nutshell, I have had some heart problem that was diagnosed. Well, we should probably go in chronological order.
All right.
Okay. When I was little, I had a tonsillectomy. That's no big deal.
Okay.
Then in 1991, I think it was, I had a hysterectomy and both of my ovaries removed.
Okay.
Then was in good health forever until in 2007, I had my first colonoscopy. And just because I should be doing that, because I was like 60-ish. Anyway, did that and found to have a polyp, so I had to have a right colectomy at that point in time because it was over on the right side and it couldn't be one that was able to be snared with the colonoscopy. And when they were doing that, I ended up, the surgeon noticed that I had an enlarged gallbladder. So she went ahead and took my gallbladder out and I had 2 huge stones, but I had never had any gallbladder problem
All right.
before. Then all was good until I started gaining a little weight, and just for my yearly physicals, I went to the doctor in around September, I think it was, of 2010, because just for my yearly thing, and he, noticed that I had been gaining a little weight. My blood pressure was up a little bit. In my family history, my mom had had a heart attack when she was like 60 years old, and so he thought that it would be good if I would have a cardiac score test done, which was then the CAT scan of the heart, and found that I had an overabundance of calcium in my vessels. So I got to see the cardiologist, and from there, then we did a heart cath, and I was found to have like 90% blockage and a couple 60% blockages. So I ended up with a quadruple bypass the day after Thanksgiving.
All right.
All was good from that until, and I was on Plavix, of course, afterwards. All was good from that until I had a ruptured diverticulum.
Okay. Wow.
Yeah, the end of February. And then had to have surgery and ended up with a temporary colostomy that I had until May. So the Plavix went by the wayside, and then that goes into, then we'll be going over all of what my other meds are, but I ended up then just on aspirin after that.
All right.
But had the takedown of the colostomy in May of 2011, and I've been just good as can be ever since then.
All right.
So,
well, wonderful.
That's it.
All right. And of these surgeries,
The physician offered to.
Go
of
ahead.
these surgeries, have you had any other medical conditions aside from the coronary artery disease? And
Well, there was the possible thing with a little bit of a diabetes,
okay.
entailment. So
All
my
right.
A1Cs have been watched ever since, and
All right.
they stay at like 6,
Wonderful.
6.2, something like that. I've
Okay.
also been encouraged to lose some weight, which I've done 20 pounds over the last year.
Wonderful.
And so that is good.
All right.
And that's pretty much it, I
Okay.
think.
So really the main things that you had was the coronary artery disease.
Correct.
And diabetes for really your medical history. Did you have any hypertension or anything, or did they just have you on blood pressure medicine for...
They have me on the blood pressure medicine. I am taking that's I'm taking losartan for blood pressure and metoprolol.
Okay.
And I have been on metoprolol for years, though. I kind of had a little irregular heartbeat back in the 90s, and so that's just always been a thing
All
that
right.
I've just stayed on. I don't notice ever anymore any irregularities. But anyway, so I'm on the metoprolol, and that is 25 milligrams, and the losartan is 20 milligrams. And then I'm taking simvastatin for the cholesterol, which they started after my bypass surgery. I've never had elevated, but they're
All right.
just doing it, and I'm taking 40 milligrams of that.
Okay, and then just...
And I take a fish oil, and then glucosamine chondroitin with some D3, and then just the full strength aspirin daily.
Okay. All right. I'm just going to go over these real quick. So you're on losartan 20 milligrams, metoprolol 25.
Yes.
The Zocor 40 milligrams.
Yes.
Full strength aspirin 325 milligram.
Yes.
Fish oil,
Yes.
glucosamine with vitamin D.
D3.
D3.
Yes.
Okay. Is there anything else that I've missed on that?
No, that's
No?
it exactly.
Very good. And are you allergic to any medicines or foods at all?
I am not. Nothing. Never have been.
Never have been. Very good. So I'm just going to do a quick review of systems. First
Okay.
off, do you have any other abnormalities? Have you had any scalp issues, lesions, anything
No.
like that? Any ear problems at all?
No.
Okay. Any normal or chronic sinus issues or anything like
Not
that?
really. No. That's
All
why
right.
then this little raspy throat, I've been thinking, yeah, but you can be looking in there and see if
Okay.
you see anything.
And you obviously you wear glasses.
Yes.
Has there been any changes in your vision, blurry vision,
Oh, no.
anything like that?
No, ma'am.
You've just pretty much.
Yeah.
All right.
Just blind.
All right. And any throat problems, thyroid problems,
None that I've been ever
anything
told.
that you've had like that?
Not that I've been told.
Any sores or problems with your teeth or your mouth at all? No. Any muscle problems at all?
None at all.
Okay.
No.
Aside from all the belly surgeries you've had,
Yeah.
have you had any other problems with constipation, diarrhea, abdominal pain?
No.
Anything like that?
No. I've
No.
been extremely fortunate.
All right. Lung issues at all?
None.
Okay. No trouble breathing?
Nope.
Nothing like that? All right. Do you smoke?
No. Not
No.
anymore.
Not anymore?
I did.
When did you quit?
Oh, Completely when I had my heart surgery.
Okay, so 2010. All right. Well, wonderful. Very good. And do you drink alcohol at all?
Just social.
Social.
A glass of wine
All
or
right.
two.
Oh, okay. Just
Not even
a
daily.
few times a year.
Yeah, month maybe. Mm-hmm.
All right. And you don't take any other drugs or medications?
No.
And you're not on any pain medicine or anything
No,
like
ma'am.
that? Very good. And I know you've had your hysterectomy and all of that. Have you had any other pelvic pain or anything?
Nothing.
Okay. No back pain, joint pains, really out of the
Just
norm?
no, like I'm old. And so I have a little arthritis.
All right.
But nothing, no.
Okay.
Nothing debilitating, nothing that stops me from doing anything I want to do.
All right. Any trouble with your bladder?
No.
Or anything like
Never.
that? No bladder pain?
Nope.
Issues like that?
Nope.
Okay. Well, first, the other thing I'm going to go over is just your family history.
Sure.
Do you have any strong family history for heart problems?
Yeah. My mom had the heart attack.
Okay.
But she only really had that. And then she did have breast cancer, but she was not diagnosed until her very late 70s. And then she died of that. But
Okay.
anyway, at the age of 81.
Yeah.
And my dad was in good health up until the time he was 65, and then ended up going into the hospital for what they thought was some congestive failure or something. But it ended up he had a lung tumor, a mesothelioma.
Okay.
But then after further review, that was a metastatic lesion, and he had a tumor on his kidney that had never been diagnosed. So they feel that was his primary site.
All right.
So that's it, though. Before
Yeah.
then, he had no problem with his heart or anything else.
All right. And you don't have any siblings?
No, I do not.
Correct. And do you have any children?
I do. I have 3 children, all natural births. They're all well and
All
fine.
right. So there's really not much else here.
No.
Okay. All right. And I'm kind of jumping back, but on your diabetes, when was your last A1C?
Oh, it was just a month or so ago, and it was 6.
6.0.
Mm-hmm.
Wonderful. Wonderful, wonderful. All right. Well, I'm just going to check
Okay.
your eyes, your ears, your neck,
Okay.
your throat,
All right.
and all that. And is there any other questions or anything else that you wanted to talk about today?
No, I think this will just be fine.
Just your throat.
Just
all
my
right.
throat. Just wanted to make sure there was nothing there that shouldn't be there.
Okay. All right. Well, first off, I'm just going to go on ahead and I'm just going to check your lymph nodes
Okay.
and check your jaw and all that.
Okay.
First off, I'm going to check the periocular nodes here, and they're normal. I want you to open your mouth and close it and clench your teeth down. Okay. All right. And there's no crepitus in your TMJ joints. I'm going to just check your nodes back here in your tonsillar. I don't feel any swollen nodes in your tonsils or your tonsillar nodes here, and just submental. All right, I'm going to check your lymph nodes down both sides here. Your subclavicular. All right, and there's nothing swollen in there. I'm going to check back here. And you let me know if there's any areas that are sore, that you have any pain at all. Okay. And I'm going to have you just try to lift your shoulders up. Okay. Very good. Against resistance. Very good. So, first off, I'm going to check your eyes. And there we go. Okay. First, have you been having any drainage or swelling or any issue with that?
No.
Okay. First off, I'm going to have you look straight ahead. I'm just checking reflex here. Okay. And look straight ahead. Very good. And I'm going to just check your oculomotor nerves. So I'm going to have you follow my finger. Make you cross-eyed. Okay? I'm going to have you go there. And to the right. And keep your head still. And down. And up. And down. Very good. Very good. Now I'm just going to check the red reflex in your eye here. I'm just going to hold your eye open and make it uncomfortable for just a minute. All right. There we go. Very good. Very good. Now I'll make you tear up a minute. All right. And I'm just going to check your sinuses because you've been saying that you've had some sinus drainage. I'm just going to put some pressure up across here. Does that cause any pain at all?
No.
Okay. I'm going to check below too. Are you having any pain in your teeth or anything like that across there? Okay. All right. Well, let me... Okay. Well, first off, I'm just going to check in your nose here. Okay. There is a little bit of redness up in there. Just kind of looks a little bit of raw, clear drainage back there. Now I'm going to have you open your mouth for me. I'm just going to check inside your cheeks here first. Very good. And there's no lesions or abnormal swelling of your gums or anything like that. Tongue's normal. I want you to stick out your tongue for me. Okay, it's midline. So now I'm going to try not to gag you. Okay, say ah. Okay. Very good. There is a little bit of clear drainage, and primarily on the left side, it looks like it's a little bit more raw down that side.
All right.
But other than that, I don't see any white patches or anything abnormal back there. And uvula is midline, so there's no deviation or anything like that. And so now I'm just going to check your ears here. Okay. And you let me know, is there any pain in your ear?
No.
Okay. All right. I'm going to pull it up and back for just a minute. All right. Okay. And I'm going to go to the other side here. Okay. Any pain or tenderness
Not
in
at
your
all.
ear or behind
No,
your ear? Okay. All right. Okay. Okay, well, both of your eardrums do look, they're just pale. It has good light reflex. There's no, doesn't look like there's any drainage behind them. Your ear canals are not red or anything like that. It doesn't look like there's any irritation. And are you having any pain in your neck at all? Okay.
Not at all.
I'm just going to check your thyroid here.
Mm-hmm.
And, okay. Okay, and there's no nodules. It doesn't feel like anything's abnormal.
Good.
It's equal bilateral. I just want you to swallow for me. Okay. All right. Okay. All right. Well, sounds like you just, it looks more like a little bit of just some rhinitis.
Okay.
Probably some drainage going down the back of your throat that's causing the irritation. Probably what I would do is saltwater gargles.
Okay.
You can just do, I would say do a couple a day. And then also maybe some Tylenol or ibuprofen if it is uncomfortable. And I would probably steer clear of taking any sort of decongestants that interact with any of the blood pressure or heart medicine. So if you were going to need some, if you are more congested, probably do something like Chlorcidin.
Okay.
And other than that, if it gets worse, you know, if you start having trouble swallowing or trouble breathing, more or less trouble breathing, if it does feel like it's getting very swollen, definitely get back to the doctor or go to the ER. If the drainage in your nose is changing color, or if you start having more of a cough or yellow-greenish drainage when you are coughing, I would definitely come back. But as long as it's clear, you're not running fevers, probably, unfortunately, let it run its course.
Okay.
All right.
That'll work.
Well,
thank you very
so
much.
much.
Thank you.
Thank you.
Mhm.